Thank you, Joe. We'll be gentle with you. It is my pleasure to welcome the Honourable Dustin Duncan, Minister of Health, to our Fall Representative Assembly. Mr. Duncan was first elected as MLA for the constituency of Weyburn-Big Muddy in June 2006 at the age of 26. Re-elected in the 2007 general election, Minister Duncan served as chair of the Standing Committee on Crown and Central Agencies prior to entering Cabinet. In May 2009, Premier Wall appointed Minister Duncan to the Saskatchewan Cabinet as Minister of Tourism, Parks, Culture and Sport. Appointed 2 months before his 30th birthday, Minister Duncan is the youngest Cabinet Minister in Saskatchewan history and one of the youngest in Canadian history. In June 2010, Mr. Duncan was appointed as Minister of Environment, Minister responsible for Saskatchewan Water Corporation, and Minister responsible for Sask Energy. On May 25th, 2012, Minister Duncan was appointed as Minister of Health, and we're glad he was. The SMA Board of Directors had the pleasure of meeting with Minister Duncan and Minister Randy Weeks, the Minister for Rural Remote Health, for the first time prior to the Fall 2012 RA in Regina. Minister Duncan is active in his community and is a past board member of the Family Place, a community-funded, community-driven resource center for families in Weyburn and the surrounding area. Minister Duncan and his wife Amanda, a musician, make Weyburn their home. We're really exceptionally pleased with the access we have to our ministry in Saskatchewan, all the staff, the ministers, the deputy minister. They really take an interest in what matters to physicians, because they know that what matters to physicians is what matters to the patients. So for his address now, please join me in welcoming the Honourable Dustin Duncan.
Thank you very much, Claire, for the introduction. Good morning, everyone. I'm very pleased to be here this morning at the Fall Representative Assembly. I want to express my thanks to Dr. Kozorowski and Dr. Patiachi for inviting me this morning. Minister Weeks, as Claire pointed out in her introduction, Minister Weeks and I had the pleasure of meeting with the Board of Directors yesterday, and we appreciated the opportunity to have a great dialogue during your meeting as well as during the evening supper. We certainly, and I can say this with absolutely no reservations, we value the collaborative relationship that the government enjoys with the Saskatchewan Medical Association and your commitment to patient and family-centered healthcare. And we share your commitment. 4 years ago, we started our journey to transform our healthcare system with this very concept that the patient comes first and needs to be actively involved in their own care. That principle is driving quality, safety, and service improvements throughout the system and at the front lines where service occurs. Every healthcare decision we make should be assessed through a patient-first lens. It helps us provide improved access to quality healthcare services that make a meaningful difference to patients and their families. Physicians are at the forefront of providing quality patient-centered care and are key players in moving further in this direction. When I addressed your assembly in May, I spoke about the importance of physician engagement and about how your leadership is at the heart of making any and making all meaningful change in the healthcare system. Without involved, engaged physicians, we couldn't transform Saskatchewan's healthcare system into one that is truly patient-centered. And without accountability, which I know is the theme of your conference, we couldn't affect any lasting change. That is why your example and your support are so important as our entire healthcare system undergoes significant changes. The SMA continues to be an important partner in bringing about the transformation that we're seeing in the healthcare system, and you've played a big role in helping us achieve many successes. I want to take a moment to thank the SMA and physicians across this province for your outstanding work in reducing wait times for surgeries. The Saskatchewan Surgical Initiative has made remarkable progress. With support from our health system partners, we're working to ensure that all Saskatchewan residents are offered necessary surgery in less than 3 months, and physicians are playing a vital role in this success. You should know that a number of improvement initiatives are on the horizon beyond the surgical initiative. Our government's throne speech last week focused heavily on key areas where we will ask physicians to play a large leadership role. We are committed to improving emergency department waits and patient flow. Our goal is that by 2017, no patient will wait for care in emergency departments in hospitals throughout this province. It's another ambitious goal, but I believe it is one that is possible. We've done it with surgical wait times. We can also do it with emergency department waits. We know the healthcare system has struggled for years with meeting the needs of patients with complex needs who enter the system through hospital emergency departments. It's estimated that 1% of the patients in our healthcare system account for about 1/3 of all healthcare expenditures. 1% of patients accounting for roughly 33% of our health budget. In the coming year, we'll launch pilot programs here in Saskatoon and Regina to identify and assist high-risk, high-use patients who repeatedly show up in our emergency rooms. This initiative, which we're calling Hotspotting, will connect patients who are currently not well served by the current system with the appropriate services outside of an emergency room. This innovative approach to meeting complex patient needs will support the work already underway, to meet the mental health and addiction support needs of Saskatchewan people. 1 in 5 people in this province experience a mental health or addictions problem. It affects people we know, our family members, our neighbors, our co-workers. This spring, we committed to developing a comprehensive action plan to increase patient access to mental health and addiction services. We've seen the patient-first approach work time and time again, so we're asking Saskatchewan citizens to be a powerful voice for change in our healthcare system once again. Dr. Fern Stockdale-Winder, the commissioner leading this important work, began meeting with stakeholder groups in August. Several weeks ago, when we invited the public to share their experiences and advice with us through an online consultation tool, and the volume of feedback to date has been remarkable. Their feedback will help us make meaningful change in the lives of Saskatchewan people by improving mental health and addiction services right across this province. And I look forward to the completed action plan next fall. Again, physicians will play a major role in this initiative. Saskatchewan seniors are a significant and a growing segment of our population. We are committed to improving their quality of life and quality of care. This past summer, we conducted the most comprehensive review of long-term care facilities ever undertaken in our province. The review identified, along with positives of living in long-term care, many concerns with care some residents have been receiving. We will also take steps to reduce pressure on the long-term care system. A new home care pilot program, Home First Quick Response, that began in Regina will soon expand to Saskatoon and Prince Albert. Doctors will have an important role to play in our efforts to improve care for seniors. In the months ahead, we will also announce the details of a program that will enable some seniors with complex issues to receive house calls from physicians and other healthcare providers. Know that we will work in partnership with you to decide how this should best play out in practice. We're also focusing on strengthening our primary healthcare system. Last year, we announced a new approach to delivering primary and emergency care in rural areas. The collaborative emergency centers are open 24 hours a day, 7 days a week, and provide stable, predictable access to primary and emergency care for patients in our rural areas. These centers also make better use of a full range of health professionals, working to their full scope of practice with a physician as a key team member. This fall, the first CEC opened in Maidstone, and in the coming months, others will open in Shaunavon, Spiritwood, Waka, and Kenora. Physicians have been vital in developing the framework that underpins these CECs. And we're hearing from physicians already that they appreciate the team support and the better work-life balance that this model provides them in small rural communities. I want to thank you for your support and continued leadership in making these centers a success. Physician involvement and leadership continue to transform the healthcare system in a variety of other successful initiatives. We're seeing that repeatedly in lean projects and their impressive results. And I want to thank you for your solid support of lean. This fall, we introduced a lean leader certification process designed specifically for physicians who are often challenged by the time commitment given your other responsibilities. This new modified track requires approximately 22 days over the course of 12 to 18 months for certification, compared to close to 80 days for the full program. And I'm very pleased to see that many doctors are enthusiastically signing up for this unique training opportunity. Another priority area is physician recruitment and retention. As the province's population grows, attracting and keeping new doctors in Saskatchewan is especially critical. We've seen a lot of success in this area. In fact, since 2007, our physician workforce has grown by more than 300 physicians. Yet we know there are still challenges. As a result, I'm pleased to count on Randy Weeks, the Minister of Rural and Remote Health, to help address this and other issues around rural and remote access to health care. Later this month, doctors and other care providers will get together to discuss the best ways to stabilize physician numbers in rural and remote communities. Minister Weeks will attend this session and will be very interested in your advice, your suggestions, and your feedback. We look forward to working with you more on this in the coming days and months. I want to use this opportunity to touch on a patient safety issue that affects us all. We need your active involvement in making our health facilities safer for patients during the influenza season. We have to work hard to improve vaccination rates among physicians and other care providers. For patient safety reasons, we strongly encourage all physicians, nurses, and other workers in our healthcare system to receive an annual influenza immunization. For those who are unable or unwilling to receive the vaccine, we recommend that during the flu season, they wear a procedure mask while working in patient care areas. In the coming days, I will issue a position statement with health region CEOs and the SMA to this effect. Like anyone, I'm not particularly fond of needles, but as you can see, I got my flu shot during the break, as many of you did as well, and I encourage you all to do so. Our entire healthcare system is undergoing significant changes as we refocus our efforts on putting the patient first. Together, we're working towards common goals: better health, better care, better value, and better teams. This will help us provide truly patient and family-centered care to Saskatchewan residents. And on this journey, physicians can lead the way every step of the way. As I mentioned, surgical wait times continue to be front and center. Primary health innovations are becoming established. Lean successes continue to show the great potential of this approach to transforming our system. Emergency wait times, mental health, seniors care, and rural physician stabilization will require system-wide solutions. Reducing clinical variation and enhancing sustainable appropriateness will also require physician involvement and support. These are issues that won't be solved in a year or two. They're transformational, and it will take the collaboration of our entire healthcare system and all of our partners, including physicians, to achieve them. In closing, I encourage you as physicians to take up the challenge to lead, whether it's by example in your practice, by taking part in committee work, or by getting a voluntary flu shot to protect yourself and your patients. Your influence with your colleagues and your patients and your communities is truly profound and makes all the difference. There's no question that we have come a long way, and yet we still know that there is work to do. With physicians on side, all kinds of great things are possible as we work together to transform Saskatchewan's healthcare system. So please accept my gratitude for your partnership and for your commitment to furthering patient-centered care. And with that, I would be pleased to take your questions. Thank you.